When people get ketamine in an inpatient residential context, allows them to develop new hobbies and new habits while, they have the time to concentrate on themselves. You can change your diet, you can exercise, you're not on this tough work schedule. You can focus on prioritizing your sleep, exercising, these kind of things.
Welcome to Head for Wellness. Join us as we explore groundbreaking paths in mind-body health by featuring insights and innovations that are helping people lead healthier, happier lives, thanks to cutting-edge developments in the field of behavioral health. Hi, I'm Melissa Davis. In today's episode, we are going to take a dive into the fascinating world of IV ketamine treatments. Today, we will sit down with alternative care advocate Warren Gumpel and discuss all of the benefits of IV ketamine treatments. Join me as we head for wellness. Hi, Warren. Thank you for coming today. How long have you been working with IV ketamine?
So it's been a project of the last 10 years.
I found ketamine for myself and it really saved my life, changed my world. Coming out of such a bad depression, and after the ketamine worked so well for me, it occurred to me, why don't I just dedicate my time to learning about this treatment that works so well and becoming an educator and advocate for IV ketamine.
What brought you to use ketamine in the first place?
I just suffered from, my entire life. I'd have these, terrible depressive episodes, and I couldn't get out of it. Probably started on my first antidepressant in my early 20s. I luckily found an article about IV ketamine and ran across it and was lucky enough to find it, and it brought me out of that depression.
And what are the benefits of IV ketamine versus other methods like traditional medicine or what people have used in the past?
I think with ketamine and, in this whole world of these new medications that really work on neuroplasticity, is unlike some of these other medicines where you take them every morning and they constantly are manipulating your neurotransmitters, and even the top psychiatrists in the world might not be able to tell you exactly what they're doing. I think with the ketamine, we understand that, first of all, the ketamine's in and out of your system in a couple of hours, so you're not getting the benefit because there's a medicine, cycling through your system that you're taking every day, but it's rebuilding new neural pathways, and, it's building the underlying architecture of your brain and perhaps building thought patterns around your depression and around your anxiety.
And I know with traditional medicine, they can take sometimes 3 to 6 weeks to start working, then you might have to shift them again. How quickly can someone experience a benefit from IV ketamine?
Oftentimes people have benefit after the first treatment. That's not everybody, but for most people after 3 or 4 treatments, significant improvement in mood and function.
Now you mentioned Ibogaine as a psychedelic. Is ketamine considered a psychedelic?
This is a topic of controversy. There are psychopharmacologists that say, well, it doesn't react with XYZ receptors, so it's not a traditional psychedelic. But in my world, it's a psychedelic, and I'd say it's 50-50 split. If people want to parse hairs, certain psychopharmacologists would say it's not a traditional psychedelic.
Okay, so it's still a topic of debate.
It is.
Whether it is or not. You mentioned to me in the past, kind of in comparison to if I have a headache and I take an Advil, or if my knee hurts and I take an Advil, the Advil knows where to go. You mentioned the ketamine reacts kind of the same way when it comes to where it needs to be used in the brain.
Yeah, it's one of the really interesting aspects of it is, and some of this gets into areas where it's hard to describe, but ketamine seems to travel through your memory bank and stop in some of these formational memories that you might not think about too much. I hear commonly to describe it as people feel like they're kind of standing in the doorway, watching some of their childhood memories perhaps unfold in front of them, as you kind of feel detached from it. And oftentimes people are able to rework and recontextualize those memories so they no longer have that physiological trigger in the present.
In your experience, what's the most effective way to administer? Is it 1 infusion, 6 infusions? I've heard different people say different things. Or how spaced out are they supposed to be?
I always recommend to follow the most evidence. The most studies have been around the 6 treatment protocol that was developed at Yale University in the early 2000s. When I'm helping people find clinics, I look for clinics that are following that protocol just because there's more data.
And does insurance generally cover an IV ketamine treatment, or?
Unfortunately, it doesn't.
Okay.
I've worked in a variety of organizations that have pushed for insurance companies to start covering IV ketamine. There are some insurance companies that have been dabbling it, and hopefully we're on the brink of it being covered.
Thank you for coming. Thank you for fighting the good fight, because I think without these alternative medicines, people being open-minded and educated about it, because traditional medicine isn't working for everyone.
Thank you for having me. I appreciate it. Doing such great work, and it's my pleasure.
Head for Wellness is made possible by FHE Health. To learn more, go to fhehealth.com/headforwellness.